welcome in. Are you here for the consultation? Okay, very good. Can I get your name, full name? Okay. Date of birth? Okay. And your phone number? Okay. Email address? Okay. Very good. So we have in our file that you did make a call about scheduling a consultation for a couple different procedures. Is that true? Okay, so you want to kind of do this all in one go, or potentially multiple procedures, but you want to book them now, is what you're saying. Okay. So I see you're interested in the blepharoplasty. Okay. And you want that for upper or lower? Okay, both. And then the rhinoplasty as well. Okay. What was that? Okay, yeah, so I would recommend doing them one at a time. So we could do the bleph first, have that heal, and then do your nose. We can do them both at the same time, but in terms of recovery and just your comfort level after recovering, it will be a little bit intense for both of those. So if you can, I would say schedule them out at least 2 months within each other. Okay, yeah. So which one would you like to do first? The bleph? Okay. We can definitely do that. And you want to start getting these done pretty soon, right? Okay, let's see our calendar. Today is November 5th. So I know this is very short notice. I can put you in for Thursday, the 6th. You have time? Okay. So that would be, I would need you to come in by 8 o'clock just to get us started. And then by 8:30 to 9, we could start the procedure, okay? Okay, so I'm going to schedule you in for 8 o'clock on Thursday, November 6th for your upper and lower bleph. Yeah, we will do both procedures in-house here. Okay, yeah, that is a good question. So if anything were to happen on the table, I mean, we avoid that at all costs, you know, but if an emergency were to take place, we have Cedars is right down the street, okay? So we would just have you helicoptered there. It would be extremely quick, and we would make sure that you're taken care of, okay? Okay. Our doctors are very skilled though, and I will also be in the room during the procedure, okay? Yes. I don't want you to be stressed out, especially if you are doing the procedure, if we're doing the procedure tomorrow. it's best that you are relaxed, calm. I will ask that from about 8 o'clock tonight till tomorrow when you go in, that you don't drink any fluids or eat any food, okay? It's very important. And we will confirm tomorrow that you listen to those requests and make sure that you don't have anything in your system, okay? Because that could cause an emergency, okay? Okay. So go ahead and eat a good meal today. Before 8 o'clock, make sure that you're well hydrated throughout the day, and especially when it gets close to 8 p.m., so that you're hydrated, relaxed, get a good night's sleep, okay? Okay. Okay. Now let's talk about payment. We can put you on a payment plan, or we can pay up front if that's something that you're able to do. There's no interest on the payment plan, yes. Yeah. You want to do that? Okay. Let's see. So we can put you on a plan. Would you rather pay more in shorter amount of time or less in a longer amount of time? You want to kind of just knock them out? Okay. So what we can do is, there's a few options. We can do $1,000 a month for the next 4 months. We can also do $500 for 8 months. We can also do something in between that. Okay, you want to do the 1,000? Okay. Let's see. You don't have a card on file. Can I get your card information so we can just put that in? We can do automatic payments, or we can have you do it manually. Okay, you want to do automatic? Okay, that definitely makes it easier. Thank you. This is Visa. Okay. Just gonna put in your information really quick into our file or into our system so that we can do the automatic payments, and that will start tomorrow, okay? Okay. And then the billing days will be on the 5th of every month for the next 4 months, okay? Okay. And then the same thing for the rhinoplasty. Okay, so that one is going to be, that would be $1,000 for 3 months. Okay. So we'll just add on, if you want to do this, if you want to wait after your payment processing and everything, that would be 4 months from now, and then we would roll over into the next one, or we could add on top of that if you want to do the next procedure in the next like month, or you want to do that. Okay, so if we schedule the rhinoplasty for next month, we will just add on to those payments as well. Okay, so that would be $2,000 starting next month, $2,000 every 5th of the month. Okay. And then your payment would actually all finish at the same time, which is pretty convenient. Yeah. Okay, now that we've got that out of the way, here is your card back. You're welcome. And let us do a quick little examination of your face, okay? I also am going to ask that you hold off on using any products, makeup, skincare, moisturizer, sunscreen from this point on until tomorrow, okay? Okay. Do you mind if I touch you? Okay, very good. I'm just going to check under your eyes a little bit. I'm gonna palpate the skin a little bit just to see the elasticity under there. And then above your eyes. Very good, very good, very good. Okay, I'm gonna hold your eye, and I'm gonna hold onto your eyelid, gently pressing down, and I want you to try to open your eye, okay? So I'm going to have my fingers like this, and I want you to try to open your eyelids, okay? Okay, very good. Now I'm going to hold your eyelids up, and I want you to try to close them, okay? Okay, very good. Good muscle control. Okay, I'm gonna check just the sides, see. I'm gonna kind of manipulate the skin around your eyes just to see what that's like. I'm gonna go to the inner, under, outer, above. Okay. Sorry if my fingers are cold. Okay. Good. I'm gonna take a couple measurements of your eyes really quick. Just to see. Okay. 1, 2, 3. Okay. And then just measure in between as well. Okay. Very good. And then I think that's all I need from you today. If you want, we can also do some measurements on your nose as well. Okay, just to save time for the next consultation. Okay, so I'm gonna start on this side of the nose and go around, okay. And then above. Very good. Okay, so you are all set to go today. Remember, no food or fluids after 8 p.m. tonight, okay? Keep anything off of your skin that you can. If you want to wash it tonight just in the shower, just use, normal, non-abrasive cleanser, okay? So nothing with those grainy little beads in it, okay? Okay, make sure you clean it off well with water, warm water, and then get a great night's sleep, okay? And we'll see you tomorrow morning. Okay, I'll see you then.